Hi there, this is Beth Russell with Studio Sapan, and I'm going to show you a quick gua sha routine along the lung and large intestine channels from the thumb all the way up to the neck to help with the health of the metal system of our body according to Chinese medicine, which helps to define boundaries and it helps to protect our borders of the body from attack by viruses, bacteria, and anything like that. So what we're going to do is start. I started with a balancing oil from Thai Herbal Topicals. It has clove as well as ginger and turmeric in it that are gentle. They're Thai varieties of ginger and turmeric that are very gentle on the skin and don't stain it as much, although it is bright yellow. Then I also use jojoba oil to dilute that slightly. And it still has a texture that is not too oily. So we can still glide the gua sha tool with a little bit of friction across the skin. So I'm going to start on the thumb here. And I put oil all over this area at the base of the thumb, coming up. Still learning how to use the camera correctly. So we're coming up here across this part of the arm to the elbow. So we want this part of the elbow in a tender spot right here to be activated as well. So we really want to put oil all over this area and then follow it right up the shoulder to the neck, under the side of the ear, down the side in the front of the neck, and under the collarbone out to the shoulder. So, and also, of course, the back of the neck. So those are the areas that I put oil, just a little bit, so we can use a gua sha tool. You can also use acupressure to press these points all the way up. You don't have to use gua sha, but it will make it more effective to use a tool to scrape. So we start by looking at the nail bed. We're going to this corner of the nail bed, and we're going to just gently it's almost like we're scratching off a lotto ticket scratcher. So imagine you're just really getting to the surface and stimulating this point until it feels sore, actually. But it doesn't have to injure the area. It might turn a little bit pink. It's just going to feel sore, and that is what we want to accomplish, a gentle soreness that dissipates. It might even feel itchy afterwards. So then we follow the channel down. Here's the bone, and we're going to find the little line directly towards the palm from the bone. There's a little ditch along this area. This area can actually help to treat neck pain. If you're having sinus congestion, this can help relieve the feeling of stuffiness that you might get like around the jaws and the neck related to sinus congestion as well. So we want to really stimulate that line right next to the bone, right here. And if you are having active symptoms of congestion, this can also feel quite tender. Luckily, all of my congestion went away in the past couple days, so this isn't really sore for me. It just feels good, and almost like when I press along here, I'm just turning a little bit pink. It just feels good, like I'm scratching an itch or creating a little massage. So now this tool is nice because I can actually grab both sides of my arm like this. So I can really stimulate two channels at once this way. So this is the lung channel here. And while we're on the hand, we'll just go on to the large intestine channel. So we want to go to this point on the pointer finger. So we're going to do the same thing. Stimulate that corner of the nail bed, not onto the nail, and we're not getting the cuticle. It's just that side right next to it. And then we can go down the finger, scrape down the side of the finger right here. And then the other important point is right in between the pointer finger and the thumb. This is called joining valley, just like here's one mountain and here's the other mountain and here's a valley. So we find a tender spot in there and we again scrape it. So I like to press toward the bone of the finger, toward the metacarpal here. So we're going to scrape along here until it feels gently sore, just slightly, with pressure a little bit harder than scraping off a lotto ticket covering. I think that's what people do still with that. I don't know. It should start to feel warm and it should start to look a little bit pink. So there's a little bit there, hard to see, a little bit of pinkness. And then we're going to come up this part of the arm. So the large intestine channel follows the arm. If you hold your hand like this, straight across, we're going to see the large intestine channel coming from the base of the thumb all the way over to the outer bump of the elbow. So let's see here. Coming across here to here. And at the base of the elbow, we're again going to gua sha. And you can do this along the whole channel. It should feel relaxing too because there's a big muscle here, the brachioradialis, that is very important for doing this movement. And we're gonna gua sha that. So if you have a flat tool like this, you can just use that surface. If you have a notched tool, you can actually put this across the top, and so it kind of grabs the whole muscle. And that is a really effective way to gua sha that area. And I'm pressing pretty hard, so it's turning bright red. Let's see if I can show you. It's turning pink. Okay, so it's pinkish red, and it will be fading a little bit. But if it turns into little tiny red marks along the channel, then that's actually fine. That's one thing that we want to accomplish. And it should actually start to feel a little bit itchy when we're doing this. So I'm going to turn it. You can see the redness a little bit better now. So now you can see how when I use this tool, it comes along, grabbing the, it's actually grabbing the radius. So we have the ulna and the radius. So this is actually grabbing that bone and massaging the muscles on either side of it. Now we're getting into the crook of the elbow. We're on the outside corner of the crook of the elbow. And we're really massaging this area and scraping with a flat scoop up, just going one direction. We're going towards the body right now. If you had a lot of symptoms and congestion and you're feeling like you're fighting something off, you could also move it the other direction to try to get rid of that illness. But in my opinion, just pick one direction to go and stay with it. Now we're going up the arm. Now we can actually grab the biceps. I have a little tiny biceps, so we can grab that one with this gua sha tool, again with a notch going right over it. You can feel kind of either side of it. So that's going to start turning red or pink. And then I'm twisting it a little bit. So I'm coming up to the side. So we're going to aim for from the outer corner of the elbow, straight up the shoulder to the deltoids, right over the deltoids. So we're going to go this way, right up over the big kind of chunky deltoid area. We want to massage that and scrape it all the way up. Okay, so now, my arm is feeling warm, and this is really good. So it's really stimulating the blood flow in the lung meridian, the large intestine meridian. That's exactly what we want to do to stay healthy right now. We want to protect our digestive system and our respiratory system. So we got up the arm all the way from the thumb and finger all the way, so large intestine came all the way up this way, up to the deltoid, right here, the lung meridian. We went from the thumb down the inside of the arm to the crook of the elbow, and then up the bicep. So now we're going to come to the side and back of the neck. So I like to use the notch area for the side of the neck and the back of the neck, and use these two little bumps to press into acupuncture points at the base of the skull. So that's what I'll just demonstrate with this. You can also use the flat side too. I just, for the purpose of stimulating it more strongly, I like having the two bumpy edges, but you can certainly do it with a flat part too. So now we go, on this one, you can go up and down. For the neck, I actually like to start going down the neck. So we're going to start at this, it's already turning red, so this one is going to be quite colorful on me since I got a lot of neck tension. So we start behind the ear and just come straight down. And you got to use the other arm for this, because if you try to do it the same arm, it's too tense. So we go behind the ear, straight down, the top of the shoulder. So this area treats the gallbladder channel as well as the large intestine channel. And we're going to go straight down from the ear out to the shoulder. From the ear out to the shoulder. And then the same thing behind the neck. We're just going to start going straight down the neck. And this should also feel a slightly bit tender. It should feel like it's stimulating a tiny bit of tenderness at the surface level of the skin to again help stimulate the circulation and help to activate those areas very strongly. So it should turn an interesting color. And you know, we're not going anywhere, so unless you have some very fancy people to see on Zoom, then having this color should actually be fine. And it will dissipate within 7 to 10 days, probably sooner. If you get dark coloring marks, like even purple color, that means that you just had a lot of muscle stagnation. There was not a lot of oxygen getting to those tissues. So you're doing it a big favor by oxygenating, by bringing that blood to the area. So, at the back of the neck, down, side of the neck down this way, and then more gently along the front, because there's more vessels and nerves coming down this area. We have to go lightly along the front side of the neck. Very lightly down this way. And you can see the this area, I'm basically using on the scale of 1 to 5, with 1 being like barely touching the skin and 5 being pressing in directly to the muscle with firm pressure, I'm at a 2 right now, between 1 and 2, a very gentle pressure, just floating along the surface basically. So there's that. So finally, the sternocleidomastoid muscle, we want to come up and down that one. So for me, we can see the SCM is right here. We're coming up, there we go, that way. So I'm going to use the other hand just so you can see better. So we want to go this way. And when you're going across diagonally, you can use a little bit firmer pressure when you're moving diagonally across the SCM. But still, be very careful in this area. If you're pressing too hard or if you're stopping on this area, that can occlude the blood flow. So we want to keep moving very lightly with a slightly firmer pressure, maybe a 3 going diagonally across there. So again, also massaging this area can decrease blood pressure. If you are standing up when you're doing this, you might be careful. It could cause dizziness potentially. So just, again, when you're working in this area, just go very lightly and don't do it too much. Less is more for this spot. And lastly, we're just going to go straight from the sternum here, across under the collarbone, all the way out to the shoulder here. So we want to go from the center of the sternum straight across. And if you're having any congestion in your chest, you want to keep going across this way. Down the sternum, outward toward the shoulder. And again, we want it to turn pink. We want to stimulate this area. And the corner here, where your shoulder meets your collarbone, there's a soft spot called the pectoral triangle with some tough areas where the pectoralis muscle is. And we really want to stimulate that area with massage, tapping, and gua sha, because that's a very important point for the lung channel. That's actually the first point on the lung channel that is very, very important. Now, with this one, I go back and forth a lot of the time because we just want to stimulate this. If you're feeling congestion, go outward from the center to the shoulder. So we've got a good amount of color here. I'll do a separate post for the sinuses for the face. But we got the arm here, all the way up here, around the deltoid, biceps, and then back of the neck, side of the neck. I've got a good little knot there, so it actually turned bright red. And then gently along the front side, and then under the collarbone. So this covers the large intestine and lung channels. There are more large intestine points on the face. We'll get to that with a face post. So thank you for staying with me, and I'm going to go have fun working this on the other side. By the time I'm done, both of my arms are going to be glowing and warm, and I'll feel like my muscles are all loosened up, and I'll be ready to carry my baby around even more. And somebody is saying hi, so I better get going. So thank you so much for listening to me, and please ask me any questions that you have about this technique, and I hope that this helps you during a pandemic time to stimulate your boundaries and borders and nourish yourself and your body in your free-flowing, clear river of extracellular fluid that is going to really help to nourish your immune system. Thank you so much.